Hello, everyone. I'm very happy to talk with you today about the Center for Aging Research and Education, otherwise known as the acronym CARE. And CARE was founded about 10 years ago by Dr. Barb Bowers, a nursing researcher who really devoted her career to supporting frail older adults' quality of life and quality of care, and also paid a lot of attention to the quality of work life for the people who are working in various care settings with older adults. And so that's reflected by our center's threefold focus on supporting aging research, student education on older adult health and well-being, and also workforce training. And the last point you see on this slide is our mission statement, which again sort of reinforces discoveries that improve aging and building the skills and capacity of those who care for older adults. We do not have members. What we do, we have an affiliate program on campus at the University of Wisconsin-Madison. And so we do have graduate students, staff, and faculty members who are affiliates of CARE. We work extensively, though, with stakeholders across campus, in the community, in different care settings. And so we really see our work as very much convening different parties that are working towards older adult health. And so in addition to our campus affiliates and other partners, we work with care settings of different types, for example, around clinical sites for our nursing students, a service learning course that we developed and support, of course, around the research programs of our faculty members, and also working in partnership with care settings to understand and address the needs of the elder care workforce. And then in the broader community, we also engage in various initiatives with older adults directly, their family caregivers, different agencies that provide services and supports. And then we have a history and a commitment of also specifically working with dementia-friendly groups in the community. And so I want to touch just briefly on two different areas of issues that our center is addressing and how we are working on that. So one is around aging research, where often with health research, even around conditions or health issues that impact older adults specifically, they're still underrepresented among study participants and advisors shaping that research. In addition, we are often seeing the disparities across the lifespan, especially among communities of color and underserved rural areas. And so one thing that we've done to address these issues is over the last year and a half, we have launched 2 community advisory boards that we call the Boards of Older Adult Advisors, otherwise known as the BOAs. So we have 2 of them to have different areas of Wisconsin represented. So the capital city of Madison, where the 10 members of the Madison BOA are predominantly African American, and then also in the rural southwestern part of the state, we have a BOA as well. And so their role is to advise health researchers who bring questions and study materials to the groups. And you can see on the slide different researcher comments, but we have had this group has been, or these 2 groups have been going for about a year now, and the researchers are just finding the input of these older community members from diverse backgrounds to be very helpful and informative in everything from proposals that they are working on to studies they're designing to recruiting materials that they are about to put out into the community. So examples of other issues that our center is working on is around the elder care workforce training needs. And so just 2 of those are around direct care staff. And so one is that direct care staff often lack access to educational opportunities, although as the people who provide the vast majority of hands-on care, they have a profound impact on the older adults' quality of life and quality of care. And because they lack these educational opportunities, not only do direct care staff often feel undervalued in that role, but they're really unprepared for many older adults' complex care needs. And so one thing that we have done to address that is we did develop a curriculum specifically for CNAs and other direct care staff who work for older adults. And we call this Care U. There are 6 topics currently in that curriculum around person-centered care, aging and vision, supporting older adult mobility, providing dementia care, and also nutrition and understanding pain. And I mentioned this particularly because over the next year, we are actually going to be updating and expanding this curriculum to add a health equity framework across all the topics, as well as to add a 7th topic around public health emergencies and how to support older adult health during those times. And then lastly, because we have many different initiatives, many different projects that may be of interest to you, I encourage you to visit our website, which is care.nursing.wisc.edu. We also do put out a monthly email newsletter, and we do have posts on Facebook and Twitter, and feel very welcome to, if you have any questions or comments, to get in touch with me by email as well. Thank you very much.